opportunity to greet also all my fellow panelists this morning. As we know, African countries have kept cases of COVID-19 lower than in other parts of the world. However, as we embarked on festive celebration, we are seeing a concerning upstick in cases on the continent, driven primarily by country in the northern and southern parts of the continent. This pandemic has shown us that a vulnerability in one place is a risk to us all. So it is incredibly important that the public health measure remains scaled up to find, test, isolate cases, and to trace and isolate contacts. The preventive measures also need to be reinforced and sustained in communities to keep it approved and deployed in several high-income countries, including, as we've been following the news since a couple of days now, the United Kingdom, the USA, and Canada. This really emphasized the need to be ready in our region. Countries, many countries in our continent, are continuing to report on their progress using the vaccine introduction readiness assessment tool, or what we call familiarly VIRAT, which is a tool that has been developed by WHO and UNICEF, and more recently merged with the information from the World Bank. And so far, 45 countries on the African continent have reported some data in that readiness tool. And the average readiness across the region is unfortunately only at 36%. This is really far below the desired benchmark of 80% to conduct a successful and efficient vaccination drive. The key areas that are currently needed some attention are mainly the logistics and supply chain, and here specifically the need to review the vaccine distribution strategy, mapping the points of storage, and additional backup storage facilities. As we know, we might not have enough capacity to store all the vaccine, and this should include the private sector, such as the food and beverage industry, to improve vaccine safety, to identify any adverse events following immunization, to improve demand generation, including ensuring that we listen to community concerns via social media and other platforms while managing rumors. Community have played, as we know, an incredibly important and central role in stopping the spread of COVID-19, and they will be central to the rollout of vaccine against COVID-19. So it's critical that authorities reach out to communities to listen to their concern and give people a voice in the process of developing and implementing delivery strategies. It is also critical to fight anti-vaccine information. Some of the vaccine that have received, or for which we have seen some efficacy data, will require ultra cold requirement, or minus 70 or 80 degrees. But even if it is a stable vaccine that could be stored at the regular temperature with normal cold chain condition, we need to work on the readiness to execute delivery strategy effectively. This will be, without any doubt, the biggest vaccination campaign in our history. So the planning and resources made available need to reflect the scale and the scope of this mammoth task. Prioritization is a key component of the delivery strategy, and we can learn from approaches in countries where vaccination is underway. Countries like Canada, the UK, or even the US are mainly targeting frontline health workers. So we are working really with the African countries to prepare for the regulatory approvals for the vaccine, as well as defining delivery strategies and the needed infrastructure, determining priority groups, identifying source of financing, and advocating globally for the equitable distribution of vaccine supply. So I'll be happy in collaboration with my colleagues to respond to any question that may arise during this conversation. Thank you, Dr. Tuwebwe.
Thank you very much, Dr. Mihigo. And it's good to know that we can actually prepare, and we shall be sure and are very optimistic that we shall also make it in this making history event. So Dr. Ngoy, also welcome to this panel. And while you were away, we talked about Gavi gave us what it is all about when we hear about the advanced market commitment, and Dr. Mihigo has just told us where the African region so far is in the preparations for the COVID-19 vaccination. So now over to you, Dr. Ngoy, to give us an update on the current situation of the COVID-19 pandemic in the African region.
Thank you very much, Dr. Tubo, and thank you for colleagues who have joined us, and thank you to my colleague who already briefed the colleague on the COVAX and the vaccine preparedness issues. So as of yesterday, globally, the world has now recorded about 71 million cases of COVID-19, including 1.6 million of death, unfortunately. The African continent, which include all the 54 rather countries in the African continent, have recorded 2.3 million of cases and 56,000 of death. Thus, the African continent account for about 3.4% of our cases and 3.5% of death. Now, coming to the Afro region, as a colleague might maybe remember, the Afro region includes 47 countries, mainly in sub-Saharan Africa, plus Algeria. So the Afro region has reported now 1.6 million cases of COVID-19, including 36 deaths. Thus, the Afro region account for 2.3% of cases if we compare it to the number globally. Now, in the Afro region, these numbers are coming mainly from what we call top 5 countries, that's South Africa, Algeria, Ethiopia, Nigeria, Kenya. But let me mention here a kind of a caveat to these numbers, because it's true that comparing countries in Africa is a little bit difficult, because different countries have different testing strategy and even different testing capacity. But at least for those testings, for those countries that are testing, these are the number we're having. So now if we report it to the population, each country population, what we call attack rate per 10,000 people, 10,000 population, in the Afro region, we are an average of 15 or 150, right, not to 15, per 10,000 people. And the country that has among the highest attack rate is Cape Verde, South Africa, obviously, Namibia, and Eswatini, and Botswana. As we may see, Cape Verde, Namibia, Eswatini, and Botswana, these are countries that have a relatively small population. We also at least happy to report that of those 1.6 million of cases, we have about 1.3 or 1.4 million that have recovered, which is about 85% of all cases. Fortunately, in Africa, we've also recorded several number of health workers of infection among health workers, representing about 4% of all the cases, which is equivalent to about 60,000 cases among health workers. Now, in terms of trend, what we've observed in the last 4 weeks, on the last month, on the last 28 days, we have seen a steady increase in number of cases in several countries. More than 25 countries at least have reported an increase of more, equivalent to more than 20% of cases. And these have been mainly South Africa, Kenya, Algeria, Ethiopia, and Uganda. So what we are also seeing is that from 1 week to another, for instance, from last week compared to the previous week, we have recorded an increase in terms of number of 33%. That's a lot. So for the last 7 days, in average, Africa is reporting about 11,000 cases on daily basis. That's a lot. And unfortunately, most of our countries, 42 out of 47 countries, are still experiencing what we call widespread community transmission. So this is the situation in Africa, and this is the situation in the Afro region. Thank you very much, Dr. Tebwe, and we are ready, like the colleague has said, to answer to the questions that a colleague may have. Over to you.
Thank you very much, Dr. Ngoy. 33%, that is quite a huge, huge leap. So now we've heard from all our panelists, and it's your turn, our listeners, to ask your questions. Remember, you can use the language of your choice. We have the interpretation button down there that looks like a globe at the bottom of your screens. And then also, to be able to ask your question, use the Q&A function at the Zoom application. And also remember that you'll need to provide your name and the name of the news organization that you represent to have your question answered. So to start us off, Rhoda from BBC Africa, could you please go live with your question? One question, please, for the start per journalist, because of the volume of questions that we have. Thank you.
Thanks, Fiona. Good afternoon. My question is to Dr. Maphosa. You talked about COVAX being the only true global solution to accessing COVID-19 vaccines. And yesterday, Reuters published a report based on internal documents from COVAX that the facility's risk of failure of delivering COVID-19 vaccines to poorer countries is very high. It also talked about a meeting that's currently ongoing. What do we know so far, and is there anything being done to prevent this? And if you could also mention some of the countries that have already submitted their bid on the number of doses that they expect to get from COVAX. For instance, Kenya talked about getting 24 million doses by January. Senegal as well said that it's going to get vaccines in March.
Thank you very much for that question. In the business of vaccines, as my colleague, Dr. Mihigo said, we deal with complexity, both from a logistical perspective and multiple other complexities. So risk as a subject is one that we deal with on an everyday basis. Despite the immense complexity, COVAX has met its initial fundraising target and is making excellent progress in negotiating deals with manufacturers. This will allow, as I said, us to meet the 2 billion doses by the end of 2021. Announcements will be made in due course. Gavi takes a strong, proactive approach to assessing and mitigating risk, an exercise which takes all the more importance with a project of the scale and ambition of COVAX. The documents leaked to certain news outlets were part of this risk assessment process, setting out key risks to the success of the COVAX facility that require mitigation measures. By their nature, these documents are planning for worst-case scenarios, and therefore, by no means an assessment of the current status of COVAX, which is currently on track to deliver on its targets, as I have said. You did ask about the number of countries that have submitted their requests and what they are requesting. I'm pleased to say that as my colleague also has spoken, we have been receiving vaccine requests at this moment on count. I'm aware of probably close to 47 African countries that have submitted their forms, and these are still coming through. Unfortunately, it would be premature for me to speak of specific requests at this stage, because all these are still being processed and information still being validated with countries. But we are working with countries on those plans to make sure that we meet their ambition with what we can. Thank you.
Thank you, Mr. Maphosa. Naftali Mwaura from Shinwa, based in Nairobi, could you kindly go ahead with your question?
My question goes to Dr. Mihigo. I would like to know whether there are projections indicating that the infection rates could probably stabilize after the festive season. At any light at the end of the tunnel, could we see the flattening of the curve in the region by January or towards the end of February?
Okay, thank you very much for this question. Well, I think as I said in my introductory remarks, we are very much concerned and on an alert basis as we are entering this festive season, because usually and traditionally we know that this is a period where people normally gather together. People travel from different parts of the world, within the country, to try to celebrate in a family the end of year season. So we are expecting, and we really have raised the alarm that country need absolutely to put in place measure that will avoid the repeat of what we've seen back in the summer in June, July. When we looked, for instance, on the trends that my colleague Dr. Ngoy have just mentioned, we have a sort of an increase number of cases in different countries. So if in that particular period of the festive season, there is no specific measure that are taken, we may absolutely see an acceleration of the cases. So very difficult to say how the situation will go after the festive season. I think it's quite important to stress the fact that this is now the moment to take the action, because if we wait until the end of the festive season, it might be too late. So is the curve going to be flattened at that time? I think we should not take that risk of a continuous increase of number of cases. We need rather to take all the measure now, and particularly to make sure that we can spend the holidays in a much more safer manner, trying to do some, at least minimize the risk to our own families, to ourselves, our own communities, and hopefully, as we heard from our colleague, Mr. Thabani, that vaccine are coming in the near short term, and can help at least to get back to a normal life. Thank you, Fiona.
Okay, thank you very much. We have a question, and I'll direct this to you, Dr. Ngoy, from Pamela Kumba from SABC Africa. What are the main reasons for this second wave of contamination in Africa? Over to you, Dr. Ngoy.
Thank you, Fiona. I was laughing not because of the question, but because the question comes often of the media. Okay, first let me say this. Sometimes when you talk about second wave or third wave or whatever, it's nothing else than the same pandemic. That's clear. It's the same virus. So the second wave or wave just means that the transmission of the virus in the community somehow, for some reason, have accelerated. This is what we call in epidemiological jargon, the amplification of the transmission. That's what it means. It means then, obviously, as a community, we have failed in terms of breaking the transmission chain. Failing to break the transmission chain, it means we have failed to keep the preventive measure that we have been told most of the time. That's all it means. So now in Africa, that's what we are seeing right now in terms of trend, that in many countries, we are seeing an increase of cases, which means, again, the transmission in the community has amplified. That's why sometimes we have more cases than the first time when the virus was introduced in the community. So now for the whole Africa, as my colleague said, the risk of high transmission or amplification of the transmission is still high because of what we are seeing. What we are seeing is a kind of fatigue in general population and relaxing in terms of observing the public health interventions, including social distancing, hand hygiene, and wearing of masks. So the risk is there, not equal in all countries, even within a country, it's not equal in all regions, but the risk is very real for African countries to have an increase in number of cases as translated by a high transmission or what we call a amplification of the transmission in the community.
Thank you very much, Dr. Ngoy. You introduced new words, amplification. Okay, so we do have another question from Elizabeth Merab of Daily Nation, Kenya. Would you want to come live with your question? Okay, so if Elizabeth cannot come live, so Elizabeth has a question that I'll send to you, Mr. Maphosa. Are there any countries in East Africa that have made tangible plans to procure and distribute the vaccine? Some countries like Kenya say they've made plans to get 14 million doses from Gavi, through Gavi, and expect to have vaccines by February. What is your comment on this?
Again, as I have said, we have in the generality received vaccine requests from a number of East African countries, Kenya included, but there is a process of allocating the vaccines, which is going to be initiated once all the information that has come through has been assessed. At this stage, anything on the quantities and amounts will be speculative. I will not be able to speak to that.
Okay, thank you. And Dr. Mihigo, would you have a comment on the same?
Well, I think my my colleague Thabani has been quite very clear on that. I think anything related to numbers at this time, I think will be, as he said, speculative. As we know, we have a lot of issues of supply and etc. So I think I'll give time to time, and we will probably see new development in the coming weeks. Yeah.
Okay, thank you. So back to you still, Dr. Mihigo, from Pamela Kumba of SABC Africa. You talked about a lot about the communication. So her question is, how will you manage the counter campaign based on religious beliefs currently underway in some networks, which stipulates that the vaccine carries the number 666, the devil's mark? This means Christians should not be vaccinated. And I think I'll put the same question together with the question that is talking about that some sources claim that the COVID vaccine contains genetic elements that can negatively impact the human body. Is there cause for concern?
I think this is a very interesting question. And I think we have seen similar claims and similar things in the social media. We are in a very interesting time while technology, social media has helped at least to disseminate information, to keep people up to date with the most recent information. We know very well that the tool is also being used to disseminate false information. We are currently talking about infodemic. Really, that's an issue, and I mentioned that in my introductory remark. What I can say is that at least at WHO and many other partners, we are really working based on science. We are working on based on evidence. Any vaccine, any product that is going to be assessed and recommended by WHO will be based on a very rigorous evaluation and based on science. So, and this is not new. This is something that has been the case for all the vaccines that are currently being used. My colleague Thabani mentioned the pivotal role that Gavi, the Vaccine Alliance, is playing in this role in supplying vaccine to many countries on the African continent. So I would like here to reassure people that any vaccine that is going to be deployed on our continent is going to be a safe and efficacious vaccine that will go through a very thorough, rigorous assessment before it got any approval. On the second claim as well, I think that's the same situation. We've seen the claim of genetically modified issues and in the vaccines. I think this is also not true. What we have seen, at least for these first two vaccines, the Pfizer and BioNTech vaccine and the Moderna vaccine, they've used a novel platform for the development of a vaccine, which is the messenger RNA, which is a new approach of developing a vaccine where some of the genetic information is given to the organism to induce a memory response that the body can develop the protein itself. That's therefore the immune system of the body can recognize that and start the process of developing antibodies. So this has been a very agile way of developing vaccine. It is a very innovative way, safe way of developing vaccine. So, and we can assure the community, we can assure people that even vaccine that have been developed using the platform of messenger RNA are very safe and have proven, as you have seen the data, very efficacious as well in protecting people.
Excellent. Dr. Mihigo, to you, Dr. Ngoy. And this is from Elizabeth Merab of Daily Nation, Kenya. Are you concerned about possible spikes during the holidays, and who is most at risk? I know you, Dr. Mihigo, talked about this and you talked about it too, but who do you consider as most at risk?
Okay, thank you very much, Dr. And I think, yes, as you mentioned, my colleague, Dr. Mihigo, alluded to this. Usually, when there is a kind of relaxation and a mass gathering event, as we are expecting during the festive season, that's what is our concern, that with the festive season, there will be mass gathering or reunion of families, and that's the best conducive moment for transmission of virus, including COVID-19. Yes, we are worried that it might spike at a transmission, an accelerated transmission, and afterward an increase in number. But let me say that it has been observed that usually after what we call super spreader event usually it takes about 6 to 8 weeks to see a spike. So if in countries we have this kind of event happening in several areas, with several people, we might see a spike of cases after that period, about 6 or 4 to 8 weeks even after those events. So the spike might not come immediately after the 1st of January or immediately after the 25th of December, but probably in January and February. So again, that's why we are calling upon all of us. It's really upon all of us to keep observing these measures so that we don't participate to amplification and transmission of COVID-19 during the festive season. Thank you very much, Dr. Ngoy.
Okay, so from what you're saying, Dr. Ngoy, so we expect to see spikes during the Valentine's period. Now to you, Mr. Maphosa, how long is the immunity to COVID-19? How long does the vaccine confer immunity to this COVID-19?
I think Dr. Mihigo spoke to some of this. First, we are using a novel technology especially for the Moderna and for the Pfizer vaccines. But the truth is, we have really dealt with 333 days since the pandemic and getting to a vaccine. We have not had enough time to speak and to have studies that assess how far immunity will last. At this particular point, we understand that it is strong. It is eliciting a good response from the body, but it would be too early for us to really speak of how long. Many who are familiar with yellow fever would know that it is just over the last few years that it was confirmed that it can give people lifetime immunity, but previously it was believed that it had to be boosted every 5 years or so. So we will learn with time as we gather more data and as more people are vaccinated.
Great, indeed, we shall learn as the disease is teaching us lessons every single day. So we have a question from Omar Mohammed from Reuters to you, Dr. Mihigo, and I will also ask you, Mr. Maphosa, to give a comment, because he's asking, can Gavi and WHO comment on financing? Africa needs to vaccinate 60% of its population to achieve herd immunity. COVAX will only be able to access 20%. Where will the financing come from for the remaining 40%? Dr. Mihigo.
Yeah, thank you, Fiona. This is really an interesting question. There was a very important meeting that took place this week on Monday and Tuesday, organized by the African Union Commission through the Africa CDC, where financing for vaccine was discussed. And one of the topic really was, how do we make sure that 60% of population on the African region could be immunized, of course, on top of what COVAX facility will provide. So there were a very interesting discussion that went on, and particularly how to raise additional resources. So few discussion, a few issues were put on the table. First of all, the World Bank that has promised to put money on top of what Gavi and through the COVAX facility is going to do. There is a $12 billion that has been made available for 100 countries, and countries in our region were urged to work with the World Bank to raise additional resources that could help to buy vaccine on top of what the COVAX facility is going to provide. So this is one of the funding mechanisms that could be explored. Secondly, there was a discussion on how the Afrexim Bank, which is the Africa Export and Import Bank, which is a bank from a Pan-African bank based in Cairo, also pledged to provide additional support to that. They committed to raise additional, I think, 3 to 4 billion US dollars to support that drive. But that will probably not be enough. And I think working with not only World Bank, Afrexim Bank, but also other multi-development bank on the continent, the African Development Bank that has now starting to come on board. I think there will be ways and means by which this financing gap could potentially be closed. However, as we've heard from, and he will probably speak about that, even for the COVAX facility itself, I think they are still working on how to raise additional funds to meet the 2 billion target. So this is a space to watch. This is something that we need collectively as partners to work together on how to assist countries on this region to raise resources to reach that target of 60%.
Thank you, Dr. Mihigo. Over to you, Mr. Maphosa.
Thank you. Fortunately, I had the pleasure of speaking this morning to Dr. Nsenga, really on the meetings that Dr. Mihigo just referred to that ended yesterday. The African target of 60%, it must be understood that it is a 2-year target. The COVAX target or ambition of 20% is a 2021 target, but the AMC itself actually is much longer than 2021. It goes well into the future. And so we, as I said, Gavi has worked with Africa for the last 20 years, and we see ourselves working with Africa into the future. While the AMC is time limited, it has a medium-term time frame as well, which will continue to help to contribute Africa towards meeting its 60% target that it has communicated.
Thank you very much. Yeah, so I want to believe that our listeners have had their questions answered. If we do not have any more questions coming through our way, we have a bit of 10 minutes to play with, and please note that journalists, you still have a chance to ask your question. But as we come to an end of the virtual press conference, I would like to turn to our panelists to hear any final messages that they may have for us. I'll start with Dr. Ngoy.
Thank you, Dr. Thabani. I think my final word to share with the journalists is, as I mentioned in my introductory word, Africa is among the least affected countries. Continent so far. Despite the discussion we might have on number or why is it so, and that's for me more philosophical and epidemiological discussion than the reality on the ground, what you're seeing. So despite that, can we, all of us, and of course we'll really request the support from journalists to support us in bringing this message to the public, can we keep Africa that way? Can we keep it as, in terms of numbers of cases and number of people affected, can we keep it as low as possible? It is really up to all of us. Of course, Africa has paid a high price. Maybe we are only looking at the price in terms of numbers, in terms of death, but Africa has paid a high economical price to protect itself against this COVID. Can we just keep it so that all the price we've paid for does not come to just paying for nothing? Now it's really up to each and every one of us, my fellow Africans, to keep again observing the preventive measure. Please stay safe, make your family safe, make your neighborhood safe, make your country safe, make our continent safe. Thank you very much.
Great, sounds like a preacher. Thank you, Dr. Ngoy. To you now, over to you, Dr. Mihigo, for your parting shot.
Well, thank you very much, Dr. Thabani. I think it has been an interesting conversation with the member of the press. On the vaccine side, I think we've been the last almost a year watching the progress in terms of development of the new vaccine against COVID. We knew that we cannot control for long this pandemic if we don't have a vaccine. As I said in my introductory remark, we have entered a very interesting and pivotal moment. Vaccines now are starting to show efficacy data. They're starting to become available. Now the real challenge, the real issue is how do we make sure that those vaccines also get to the people in different countries on the African continent. But I want to stress one important element. Vaccines by themselves don't, I think we need to get those vaccines to the people in order to save life. We know of country preparedness. I think there is some work to do on that field. So my real message here will be to urge countries on the region to accelerate the level of preparedness for the vaccine uptake once they become available. We at WHO, working with our close partner, the Gavi and others, so are doing our best to support countries to make sure that they are doing what it takes to be ready at the D-Day when the vaccine will land in the country. So we need absolutely to make sure that we anticipate any challenge, any problem that may hamper a good rollout of the vaccine. So we remain confident that a country that have done in the past quite very well in terms of organizing mass vaccination campaign, that they should take on their past experience, learn from the mistakes, see how to adjust strategies, and then to consider that this will be probably one of the largest vaccination drive ever that we have been seeing on this continent. So the more we prepare, the better we're going to be ready in deploying the vaccine and ultimately saving lives on our continent. So thank you very much for your listening.
Thank you very much, Dr. List to you, Mr. Thabani Maphosa.
Thank you, Dr. Atuhepe. Really, I think the first one is to thank you for the opportunity to engage in this press briefing. But secondly, is to appeal to the press and those who have access to social media to really use it responsibly. I think as Dr. Mihigo spoke with some of the misinformation that we have seen, we believe that the press has a significant role to stem the tide of misinformation. If facts can be checked, if science can be used to respond to some of these situations, it will go a long way. As the Gavi Alliance, we are worried about what this misinformation could do to the work that we have been able to do over the past two decades. So it is important that we prioritize right messaging that do not cause panic and fear. Then secondly, I think that fair and equitable access to vaccines is a priority. And when I say that the COVAX facility is the only global game in town, it is true. There is a number of bilateral deals, but those don't think about everyone as a whole. And as we have been saying in the past several months, unless everyone is protected, no one is protected. And it is important to keep this at the heart. As part of the first wave, we will, in 2020, prioritize stemming the pandemic, the acute phase of the pandemic. And that 20% is really about making sure that the frontline health workers, the elderly, and others with comorbidities are vaccinated on the front end, because they are the likely ones to be most vulnerable if they were to catch this. We have a lot of work ahead of us. We need everyone to pull with us. And the media has got a role to play, so have we. And we are looking forward to partnering with you in the long term. Thank you, Dr. Mihigo, Dr. Ngoy, and Dr. Atuhepe for our collaboration today.
Thank you very much. Thank you very much, our panelists. And indeed, unless everyone is protected, no one is protected. And again, take home message, media, you're there to make us or break us. We still count on you that we can end this pandemic. Otherwise, thank you very much. Thanks to the panelists. And again, thank you, the media, for tuning in. And we hope that we will work with you to end this pandemic. Thank you very much. And keep safe.